Borderline personality disorder is very treatable, and I've had a very high success rate over the past 35 years. But there is a caveat. It reminds me of the old joke, how many shrinks does it take to screw in a light bulb? Only one, but the light bulb has to want to be changed. If you're ready to make an ironclad commitment to your physical safety and to your treatment with a therapist who is trained to work with borderline personality disorder, then it's very, very likely that you will see substantial improvement. So I've been in practice for 35 years. I graduated from Princeton University with a BA in psychology way back in 1979. I completed my PhD in clinical psychology at the University of Massachusetts, did my internship at NYU Bellevue Medical Center. Afterwards, I completed a postdoctoral fellowship in treatment of borderline personality disorder at New York Hospital Cornell Medical Center, where I studied under Dr. Otto Kernberg, who was the most famous person in the treatment of borderline personality disorder before Marshall Linehan came along. I taught in the Department of Psychiatry at Johns Hopkins University Medical School for 28 years, where I taught psychotherapy and treatment of borderline personality disorder. And in addition to being a therapist and a teacher, I'm also an author. I wrote a book about hypomania and another one, a psychobiography of Bill Clinton. I've integrated many aspects of dialectical behavior therapy into my work. But if you talk to Marshall Linehan, the founder of DBT, as I have, she will tell you that mindfulness meditation is the core skill that underlies all the other skills that she teaches. Her personal story is actually quite interesting. She herself had a severe borderline personality disorder that was refractory to normal treatment. She more or less cured herself through meditation and built her therapy around that experience. I have a lot of patients who come to me after failed DBT therapy, and the reason is almost always the same. The therapist themselves is not grounded in a meditation practice and doesn't emphasize it during the therapy. You can learn about the skills of DBT, but unless you actually have a meditation practice, you won't have the capacity to employ them in your everyday life. So it's not that DBT is insufficient, it's that you need to do meditation in order to be able to actually utilize the skills that Marshall Linehan is teaching. If the approach I'm describing makes sense to you, then I hope you'll feel free to give me a call, either to ask any questions you might have or to make an appointment. But I do believe that if we work together, we can make progress.